You're listening to the We Are Libertarians podcast network. Find all of our shows at wearelibertarians.com.
Episode 84, The Paradox.
Welcome to The Paradox with your attending, Dr. Eric Larson. He is a practicing anesthesiologist and clinical assistant professor at Michigan State University College of Human Medicine. Listen in as he takes you behind the scenes of what practicing medicine in today's ever-changing world is like with another doctor. The Paradox is a fun and accidentally informative show for physicians, patients, or anyone who has ever found themselves in a waiting room.
Welcome to The Paradox. I'm your host, Dr. Eric Larson. Thank you for joining me as we explore the U.S. medical system in a fun, informative format through expert analysis. Today's expert is a repeat guest, Dr. Michel Accad from the Accad and Coker Report. Dr. Accad is a cardiologist in San Francisco who provides some great insights and also new perspective on the virus as it's progressing in the United States, since he's out on the West Coast and I'm in the Midwest. We'll discuss coronavirus, the response from the federal government and how it's been bungled in many ways, how people are going to respond differently to this, and some other issues that relate to it, both financial issues with physicians, but also sort of philosophically, what the best way to respond to pandemics might be, because the U.S. response, I think most people would agree, has not been ideal, and it could certainly have been much better. If you've not yet subscribed to The Paradox, I really don't know what's holding you back. Please go and subscribe on your podcast player right now. Also, while you're there, drop a 5-star review and leave a written response of what you think of the show. And of course, continue recommending to your friends. That's what helps the show grow, and I appreciate that support. Also, if you want to further financially support the show, you can go to Patreon at patreon.com/theparadox. That's PRADOCS. And there you can provide some additional funds monthly on a pledge. You will get bonus access to other episodes I do, both with the Amash Files and the opportunity to be interviewed by me. You can get all that extra access by going to patreon.com/theparadox. As always, you can find show notes to the show at theparadox.com/084. There will be links to Dr. Accad, his show, his Twitter handle, and one of the articles he references from former director Scott Gottlieb, now with the American Enterprise Institute. But without further ado, Dr. Michel Accad and the bungling of the COVID crisis by the federal government. Enjoy. Welcome. I'm here with my friend, Dr. Michel Accad, the former star of episode 11 of The Paradox. He's a cardiologist at Athletic Heart in San Francisco, direct primary care practice, which is fairly unusual for cardiology. He's also the author of Moving Mountains and the co-host of the fantastic medical podcast, which I highly recommend, called the Accad and Coker Report. So, Dr. Accad, thank you so much for joining me on the show.
Thank you for having me.
Well, it's my pleasure. And again, you're in Northern California, San Francisco. I'm here in West Michigan. We're recording this, March 29th now? It's so hard for me, March 30th. Yeah, it's hard for me to keep track when I'm not in the hospital every day, which is very unusual for me because usually I have a very good feel for what the exact day is from all the documents I have to sign. So because I do mostly elective work, I'm now idle a lot, and so it's very unusual for me. So I don't tend to know. I should be working today, and I'm not. So I appreciate you taking the time to talk with me, because I think it'd be interesting getting a different perspectives here on what's going on with the coronavirus. I think that's top of mind of everyone. You can't avoid the topic anywhere you look.
Of course,
there's no sports, there's no diversions, right? Outside of, if you're interested in economics or politics, guess what? They're only talking about coronavirus too.
Yeah, really. It's it's understandable. It's such a such a threat, an immediate threat. It's more than a threat. For most, it has affected all of us for a variety of reasons, even in places that are not affected epidemiologically. Everybody's life has changed and probably will stay changed for a long time and perhaps forever.
Yeah, I think, anytime you have these large scale events that happen in the country, you could say 9/11 had long-lasting effects, although it probably didn't personally impact most people. The political, economic, and even there are other consequences that sort of the way we travel, the way we move around through airports or whatever, all those things affect us later on. And so I think any sort of pandemic like this that's really the first one hit this United States within anyone's memory to a significant level is going to affect how Americans respond to and sort of act and behave here going forward. What, to start the conversation, I guess, let's just look at what's going on in Northern California right now. I think just speaking briefly, we just ahead of time before we came on the air, we sort of talked a little bit about what's going on locally. But in Michigan, where I am in the west side of the state, it's not real busy. There are cases, and our hospital is filling up slowly, but it's not that bad. We had emptied the hospital. The east side of the state, which is where the Detroit area, the large urban area in the state, is getting flooded with patients. It's always hard for me to get a feel for how bad it is, but I don't know if it's as bad as in New York. What is it like in Northern California where you are?
Yeah, it's actually not so bad. We haven't seen a huge surge. Certainly not in San Francisco. I mean, in the San Francisco Bay Area, I think the hot spot is Santa Clara County, which is where San Jose is, about 70 miles or south of here or so. But even there, it's not terrible. I mean, I think so far it's been manageable. San Francisco today had just, I think 24 added new confirmed cases compared to yesterday. I think the total is about 350 or so, maybe a little bit more. Not that many deaths so far. So, and the hospitals are doing okay. I'm getting, I'm on mailing lists from all the major hospital systems around here. And so far, they seem to be doing okay. And probably, I mean, I think it seems to be that probably the credit goes to the rapid measures that were implemented. The lockdown or the shelter in place, because I think San Francisco was the first community to adopt that, and then very quickly other counties in the area, and then subsequently the state itself.
Yeah, it's interesting because you look at California, it seemed to be I feel like it even reacted faster than Washington. And Washington is the one where I think the initial cases, I feel like that's where the first sort of hot spot was in the United States, where those elderly patients in the nursing home, where that,
right,
feels like
Washington State, yeah, indeed, they were hit first. So I'm not sure exactly what measures they took. I think you may be correct that they didn't take as drastic a measure as the shelter in place that was implemented here at the time. They seem to be doing okay also, at least for now. On my podcast, we interviewed an intensivist from Washington just a few days ago. They're doing okay now. He expects there will be a second wave. He expects they'll be able to handle it, but he expects that their numbers will continue to increase and get worse, and they may get to a point where they hit crunch time, so to speak. But they're not doing too bad.
Yeah, it's well, let's talk about the response of the federal government. I think our country is unusual in the sense that we have kind of 50 mini countries, which the federalist system, and so
right.
they all respond differently. It's far more federalized or nationalized than it used to be. Obviously, as every day goes on, the federal government gets bigger and more powerful, but they still have a lot of control locally, much more so than the federal government does on some level. And so the president can make a decree, and really the governors can choose to do it or not do it, to varying extents. I look at the outbreak. I mean, this is something we saw coming. I mean, it was 3 months ago now, I guess, that was first reported the variant of the year. So January, sort of, it was recognized. We had the sequencing for the virus. It's not like this is something that just happened. It was like it was de novo, began in the United States. So there's plenty of time to prepare, and yet there was clearly no preparation. And there was. We have been preparing locally recently over the last couple of weeks, but for the most part, it feels like the federal government didn't really do anything. There hasn't been any sort of adoption of testing. What do you think about sort of the initial response from the federal government and the implications of what they did or did not do?
Sure. I mean, there seems to be some snafu. I mean, I'm not, I'm sort of like Lou, just a clinical doctor. I just, things that I read, I'm not an epidemiologist. I'm not, I've never been in the position to be responsible for the public health of a country of 330 million people. So I, it's easy in retrospect to sort of analyze what happened and then criticize it. But it seems clear that there were some snafus at the level of the CDC early on. The test was available in early January in Germany, maybe mid-January. Germany had a test that was made available to the WHO. The CDC elected not to use that test, to develop its own test, and then rolled out that test under relatively strict criteria, meaning they only wanted, because at that point it was not really scalable, or it couldn't be done in large quantities. They only wanted to test certain people that met certain criteria, particularly travel criteria and so forth. And then the test itself, it turned out that they had developed was flawed, so it had to be recalled. They wouldn't allow local hospitals, local academic centers in various parts of the country. That's the CDC in conjunction with the FDA.
Right.
Wouldn't allow the local institutions to develop their own tests. Even though I think the technology for the test is not, as far as I understand it, is fairly straightforward. Once you have the sequence of the virus, which had been made public, back then in January, it's there would have been a lot of capability throughout the country to develop tests. And so they were not allowed because of, again, sort of bureaucratic reasons to do so. And so there have been a lot of delays in testing throughout the country, which I think it's reasonable to assume that it's hampered the ability of different parts of the country to prepare for the virus, for the epidemic, or to adopt one strategy versus another, right? Because you could adopt a strategy where you test extensively and then you isolate the cases that you detect, while the rest of the country, or the rest of the state or the rest of the community, keeps going reasonably normally, as opposed to having to essentially shut down everything because, by a certain point you realize that the virus is really pretty widespread and the testing strategy is not going to be all that helpful. So I think that seems to be sort of a consensus of what happened back in February or January, February, when there could have been an opportunity to intervene and change the course of things, right?
Yeah. Well, and I feel like I don't want to be inflammatory, but I will in this case. But I do feel like there's blood on the hands of the FDA, and I'm not sure what complicity the CDC is involved in that as well. But they essentially prevented the production of laboratory testing through their, like ossified sort of regulatory pattern. I know there are lots of people. I mean, I've been in contact with at least one person who has home testing that they want to institute, and they're not able to get FDA approval at this point because it has to go through studies or whatever for validation reasons. Because the FDA seems like it is less concerned about safety than it is about efficacy. The effectiveness of testing or medications or whatever, which just slows everything down. I mean, it's kind of crazy that the technology we have in this country, and yet we can't produce like you said, it's a fairly simple test. It's a PCR. Once you have the hardest part is usually getting the genomic sequence and then just producing it,
Right. Yeah. I mean, I think that's correct. Now, and as you said, it's sort of an ossified bureaucratic mentality, which predates. I mean, it's hard to blame the current people who work at the FDA because it's the mentalities are there and have sort of developed over decades of centralizing the decision-making process and not being ready to deal with an emergency and so forth. The other question is it you mentioned that we have 50 different states here.
Yeah.
Does it make sense to have one central agency, regulate 50 states that have, as we see now, because it's much clearer now than it was a few weeks ago. It's clear now that it's the epidemic has really very strong regional, manifestations. Right, you have New York, which is in terrible shape right now, unfortunately. New Jersey, other places, and then other places that are relatively okay. Could be a variety of explanations. I mean, I don't want to analyze, but it's why should there be one rule, one set of one set of criteria, one to deal with 300 million people who deal with widely different circumstances.
Yeah, I think. Well, and I think now once the FDA relaxed its restrictions on the testing and production of testing, you see an explosion of people and universities, institutions creating their own tests, and I think it's a good example. It's not what most people will notice, but I think it's a really great example of when you have a market allowed process where you have all this experimentation. You don't have the shackles of having to have a gigantic R&D budget you have to go through a testing. You can just produce things and find out how they work in the marketplace pretty quickly, and you're able to respond to something, to respond to an immediate crisis nimbly and which the FDA process, you might say, well, most of the time you can develop a test and there's no urgency in getting it done in 6 months. You can wait a year or two, and there's not an obvious morbidity or mortality that occurs because of that delay. Yet in this situation, obviously there is, right? Because you don't have the luxury of 6 months to go through the 27 trials or whatever it is to verify something.
Sure.
And also, I mean, I think it really goes to show that if you have one solution, in medicine we have this all the time, right? We always have a plan B and probably a C, D, and E, and F. We don't usually like to go to those plans if we can help it because it's usually more complicated or expensive or some other reason not to do it. But if you only have plan A and there's nothing else if it doesn't work, you're really in trouble. And that's sort of what the CDC and FDA found themselves in by insisting on this one test. It didn't work. And then you have basically policymakers and everybody operating blind. They have no idea where the virus is, how extent it is.
Right.
There's no way to track it. And so you have no strategies.
Right.
You can't adopt different things, right?
That's right. It's interesting. And also, there's a perception, and it turns out that it's probably false. I mean, a perception that the FDA or the CDC would be, in general, more conservative, more alarmist in a way, and more ready to respond to threats and whatnot.
Yes.
Where it seems that it's actually probably not the case. And so, if there's a concern that if you decentralize, that process, if there's a concern that maybe some states are going to take it too easy and it's going to be a problem, well, it's not clear that centralizing it changes that in any way. And if it changes it, and if it turns out that actually the central, the single authority actually is wrong and is more blasé about the epidemic than it should be, then we're all, much worse off, right? Whereas,
no question. I think that's a good point, because you see the fact that really the FDA and these regulators are more interested in their algorithms, the process, than they are actually concerned about sort of why they're in the process.
Yeah, it's very interesting because it's at the end of the day, it's a judgment call, right? I mean, the seriousness of a potential pandemic, it's a judgment call because you can rationalize it. I mean, there can be arguments that can be made one way or another. And it's true even if, in this one, it's true today, today there are disagreements about what should be done, from here on and so forth. It was true 2 weeks ago. It was true 4 weeks ago. It was, even truer at the very beginning. So these are decisions made under a lot of uncertainty. And I think when that's the case, then it really, that's the kind of situation where it really makes more sense to decentralize and allow sort of a variety of different strategies to respond to this uncertainty. Because again, if the central authority gets it wrong, then it's a big disaster. Whereas if you decentralize it, and we have states that at least nominally must have some kind of authority and sovereignty and whatnot, and then they can take the responsibility to for their own people, in how they respond. And then if one state is let's say was made the wrong assumptions, and was, let's say, lackadaisical, and then it turns out that they have more trouble, then maybe it can be contained in a way, or other states can respond by imposing travel, whatever. I'm not sure, legally I'm not by any means a legal scholar or a constitutional scholar, but just conceptually it seems to make sense that for these things that we're better off decentralizing than we are just having a central authority that is equally likely to be either right or wrong. I mean, there's no special reason why a centralized authority will have a better aptitude to make the right judgment on an epidemic like this.
Yeah, I think I think a market analogy is a great one. So for one thing, I think like as you mentioned, the country is gigantic. We're 330 million people. I don't know how many square acres there are in the country, but it's massive, and there are huge regional differences. And so what works in one spot may be completely wrong to work in another. Like you wouldn't have high-speed rail and all kinds of metro services in a very small community that has no population density, and so there's no reason you could have a one-size-fits-all policy for something like that. So maybe you have different policies that you'd have to have anyway, and so you couldn't have a centralized source making those decisions. But also, likewise, I mean, it's sort of like the question: how much is an ear of corn worth? Well, that's determined by millions of decisions by people and whether they need the corn for various industrial or for eating. And there's no way any one person could ever know all the demands and the supplies in the market. And so that's why sort of the market sort of all through those decisions that are made, a price is discovered, and it's constantly changing based on the various needs and demands of people. Right. And by the same token, you could say the same thing about this, like. Someone has draconian policies. They realize that all the states around them don't have that, and they're fine. So then you ease up on your restrictions, or vice versa, right? That you'd hope that sort of discovery process can occur too. I mean, there are obviously political implications in which makes things more challenging. I know that our governor probably shut things down a lot sooner than I thought we probably should have. I mean, it's all just blind luck anyway, because the governor in Ohio, which is south of us, really started shutting down earlier, and so put a lot of political pressure on the neighboring state to do something. And so, because there's always a claim, and I think Governor Cuomo said this, like, we have to do whatever we can to save just one life. Well, I mean, that's not really accurate, because if that was really your attitude, then there's lots of things you wouldn't allow. You wouldn't let people drive more than 20 miles an hour. I mean, there are all kind of a million things you do, but anyway, that's always makes it more complicated, and especially when you have no knowledge about what you're fighting. Again, because we have no testing, we have no idea. Sort of, it's the invisible invader, right? Correct.
It is. At the same time, so I think you're absolutely correct. But at the same time, I think we're not. It's not really so. So I personally don't want to completely leave it to the marketplace, essentially, because you could apply that logic and just say, well, let's decentralize more and more, and then decentralize and leave it up to the households to make their own decisions. Right, and each family or each person individually and so forth. And I don't think that's correct. I really view this as sort of a communal threat, a threat to the common good, if you will, of a country. But here, I would say that it's in the example of the United States. I mean, I think it makes more sense to have those decisions sort of either statewide or community-wide, I mean, where there's sort of a kind of a natural jurisdiction, to be able to actually force people, because I think you're going to have to force people to do, or at least there has to be that option on the table of forcing people to change their behavior in a way or, one way or another. Yeah. And so I think the political authority has to be there to respond to a pandemic like this, to an epidemic. But still, it has to be the point that I was trying to make, that there's plenty of room to decentralize without making it a market phenomenon or making it completely undirected. To decentralize from the whole United States, 330 million people, down to states, and maybe within states down to communities, large metropolitan areas or whatnot. But probably states makes the most sense, where they have at least the legal authority to do certain things, and to direct resources in one way or another, and whatnot. So that's we're seeing that happening, anyways. I mean, to some extent, but clearly, I think up until a few weeks ago, there was everybody turns to the CDC or the FDA for direction. And perhaps one lesson that we will learn from this pandemic is that that's probably the wrong approach.
Yeah,
that
I think
people,
so. I think you're right.
local political communities are going to have to take things in their own hands.
Yeah, I think this almost goes more to the level of, who do you trust? And it's very hard for people to find sources of information that they trust. You look at most large institutions are not trusted by people in this country, whether that's government, whether that's news, even like the church. I mean, most large organizations are not trusted. And so source of information is really complicated as far as, what can be verifiable. And so, I don't know, I do look at it and say, well, in many ways, most of the decisions were actually taken out of the hands of the politicians. You look at most private institutions, organizations, they sort of they stopped doing things before they were, asked to. Now you could argue that they were going to be asked to anyway, but like most of all the sports leagues, they shut down before there were edicts, from the government. I think, if you say shutting down businesses and things like that, and clearly the government had a hand in a lot of that, but people were also at that point already kind of, in some respects, social distancing themselves. And
right.
Now, not to the extent that they are now, where it's sort of imposed, but anyway, I think.
But you're right that it's it's going to be hard to know if that was sufficient or not, right? Because one could make the case that the natural degree of social distancing that happened, without any edict, possibly could have been enough. Who knows? Yeah.
Do you find yourself washing your hands more now than you used to?
I do.
Yeah,
but I don't. Right? Is it because of the edicts or not? I mean, all this is hard to know. I think you're right. I mean, part of it was. But again, I mean, it's conceivable that it may have happened to different degrees,
Oh, sure.
with different people, and certainly some people will only respond to the edict. But you're right in a sense that it's possible that just leaving it to people's sort of own, instinct, if you will, or the market instinct, that there was at least clearly there was a lot of activity happening before there was any intervention of the political authorities.
Yeah, I don't
spontaneous activity. You're right.
I certainly don't make the contention that had you not had closed the schools and these other things that people would have done that. I mean, there are a lot of people who rely on, and I even lump myself in that too. I guess this is real serious. I guess now I need to be more conscious about certain things. But I know with this pandemic, I mean, I've talked to plenty of people and they'll say things like, "I didn't realize how many times I touched my face," or things like that, where you don't normally pay attention to those sorts of things, but you start to now, and you start altering your behavior on the margins slightly.
Sure.
So one of the big things, of course, with all of this is the fact that there's now a huge economic shutdown of the country. You've seen it on Wall Street and the markets, obviously, but more presently, you see it in the restaurants are closed. Lots of stores are closed. Businesses. Is this something? Do you think that? For one thing, do you think it can sustain it a long time? Do you think this is something that's wise?
It's very it's so hard to know, and I vacillate. I mean, what's amazing is in the last 2 weeks, how much I vacillated between sort of one position of saying, well, the measures are too strong, the economic impact is going to be too harsh, and it's going to have its own consequences independent of the epidemic that may be worse, versus saying, no, well, I'm glad they took those harsh measures, because at least, in my experience here in San Francisco, it seems that we've been spared, and I can, I infer a causation from the early intervention, the early shelter-in-place edict that was put in place. So I keep going back and forth. It's very hard to know, and will we ever know? Because again, the ramifications could be for months and months and years, perhaps years to come. I mean, today I came across there was a model that says, well, maybe this flattening of the curve that we talk about, where we're trying to make the impact on hospitals not so acute immediately, but to sort of spread it out over a few weeks, so that the capacity of the hospitals to take care of these patients is not overwhelmed, right?
Yeah.
So this notion of flattening the curve, somebody was saying, well, okay, it's fine for the sort of a short to medium term, but all it's going to do is that delay, there'll be another epidemic, later on. Who knows? And that's what's so difficult, because at the end of the day, you can only respond or make causal inferences in the short term with these sorts of things.
Yeah.
For example, now when the shelter in place in the Bay Area was imposed, my initial reaction was, hey, that's too much. I mean, why are they overreacting? At the time there were barely a handful of cases.
Yeah.
And now I'm like, well, maybe that was a good idea, right?
Yeah.
But let's say it turns out that there will be a really very severe economic consequence from this shelter in place, if it's right. Will I blame them for having, it's so complicated. There's no alternative universe to compare it to, right? And
there's no RCT you can do.
There's no RCT. There's no way. So it goes back to what you were saying earlier, that at the end of the day, the problem is that if we don't trust if the politicians don't, or the institutions, don't trust us, and we don't trust them in response, then no matter what is done, is bound to leave a bitter taste in people's mouths.
Yeah,
right?
no matter what. I think it's a question. That's it.
And so the problem is that we've had, I think now, several decades of not trusting, right, the institutions not trusting the individuals to do what I clearly think they should be allowed to do, right? So this over-regulated world we live in, I think it's too much. I mean, it's clearly a sign that individuals are not being trusted. There's this, I use the term the nanny state and whatnot, and that puts us in a situation where there's a widespread lack of trust, so that when decisions are made, we can't. At the end of the day, we can't. We'll gripe because they're made. We start off from a basis of lack of trust.
Yeah, and I think with the fact that it's sort of this paternalistic system, there is an implied loss of responsibility in taking care of yourself and being right. And not only does that relate to individuals, but I think also to corporations. And so it's sort of like if let's say you developed a test, the test was found to be not work. Like say Theranos is a great example, right? Mm-hmm. Where you have someone who bamboozled so many people that you had this test that worked, and everyone would say, well, thank goodness the FDA was there and shut it down. But it wouldn't have taken that long for people to recognize that Theranos was not working. I mean, people were already kind of suspicious about it, right? It wasn't just the FDA that sort of came up with this on its own.
Right.
And by having the FDA as sort of that intermediary, or it could be any government agency for any sort of with any regulation, you've in many ways removed responsibility for the corporation that is performing it, unless they're working outright fraud, which was the instance of the Theranos. They can say, well, it went through all the FDA regulations. As far as we knew, it was a great test, and it's not our fault.
Correct. No, you're absolutely right. And yeah, it promotes a misbehavior. And what you could say here is that if there wasn't sort of such a if all these paternalistic institutions were not and highly centralized institutions were not in place, then people would have better behavior, so that in the case of a pandemic, they might be more responsible as well.
Yes,
right?
absolutely.
So you wouldn't have to impose. You would, just like in South Korea, right? I mean, it seems that people there are much more likely to sort of do the right thing and isolate themselves and wear masks, right? Wear masks, whereas here our CDC has been, now they've actually changed their tune, but up until now they were telling people that masks don't do anything, where in fact it turns out that they probably at least do something to limit the spread of things.
It defies logic that they would even make that assertion.
Yeah, it sure does.
Right. I mean, it does. There are so many things we do in medicine that I think, I question in the OR, like, why are we doing this? There's no way that this makes a difference, right? And yet we do. Like, for instance, I'll tell you, if you're wearing a mask and you take the mask off your face, you're not allowed to put it back on, because the JACO or whatever, that they say that it's a now dirty mask and it's an infection source. Of course, now we're being told to keep a mask on for days.
Right.
To continue, don't stop using it. Which actually makes much more sense. I mean, I understand that if you think masks are during the outside, you can certainly wipe it down, whatever. But there are lots. But the fact that covering your face wouldn't prevent the spread of disease. It doesn't. I mean, any sort of. I'm a nuclear engineer as an undergraduate, and so we always talk about shielding for radiation. Well, obviously, if you have a piece of paper in front of you, it's not going to be as good a shielding as a piece of lead. But if I'm wearing a jacket, it's better shielding than a piece of paper. If I'm wearing a lead-lined jacket, it's much better than a regular jacket, which is much better than a piece of paper, right? I mean, So all those are better than nothing, right? So it's just a matter of degree. I mean, obviously, a mask is not as good as being in a hazmat suit, but it's still going to provide you some sort of protection. It was obviously, I think, just an edict set down, basically prevent people from not allowing these limited supplies from getting to people who are in the healthcare, world.
Right.
Which is a travesty, right? I mean, but I also think, I look at this sort of like I do with the TSA and with 9/11, and I think it's a fairly good analogy, because with 9/11 you had hijackers that took a plane with box cutters, right? I think just knives or something. Mm-hmm. They hijacked a plane because all throughout history before then, every time someone hijacked a plane, they basically took the plane somewhere else. They never used the plane as a weapon with the intention of crashing the plane. And so everyone in the plane was docile in the sense that they were like, well, let them do whatever. They can take me to Cuba or whatever, and they'll figure out some way for me to get home. But I feel like right after 9/11, there would be no way ever taking a plane with box cutters, unless you had more people with box cutters than the passengers of the flight. The passengers would do everything they could to stop you.
Sure.
Because there's a history now. And likewise, I think you look at Southeast Asia, their response to a pandemic and to infections, I mean, they're much more familiar with it, like with SARS and H1N1, a much bigger deal back down there. And they never really hit the shores of the United States very much. So I think our response to it is varied that way too. Like, I would think the next time this happens, people are going to be much more serious about protecting themselves and social distance and sort of washing hands and stuff. I don't think it will be the same issue. And I don't think it's a nature of us as Americans as much as an issue of experience.
Right. No, you're right. Bureaucracies have only a very limited way to respond to things. First of all, they respond to the previous, right? They institute their measures to respond to the previous, to whatever they've just experienced.
Right.
They're not going to be sort of anticipatory in the same way. They're always going to anticipate the stuff they've been exposed to before. So now the TSA thing is all about, box cutters and whatnot, where, if there was another terrorist, it would completely, use a different way of terrorizing a country. And likewise, and also they have to, they apply very strict rules. I mean, they have to articulate things in sort of, things they can put in a decree or an edict or a regulation and whatnot, and they can never. These things, can't be adjusted up and down, and they can never make the proper calculation. For example, one thing that struck me in this, I received an email from a hospital system here. Hospitals had been, for many years now, they mandate their healthcare workers to get the flu vaccine.
Right.
But there may be, a handful in each hospital who, for a variety of reasons, don't want to get the flu shot. And if that's the case, that they mandate those, the ruling was to mandate those people to wear masks all the time, right, throughout the flu season, to wear a mask even if they're feeling well. They have to wear a mask, 100% of the time, even, regardless of what they're doing. Well, now with this whole shortage, then there was one hospital system that said, no, we're revoking that ruling. Under the current circumstances, the people who are not vaccinated, healthcare workers who have not received the flu shot, don't have to wear a mask. Well, how does that make sense?
Right.
I mean, it's sort of incredible. I mean, you can understand why they would do that in terms of mask supplies and whatnot and so forth. But at the same time, how do they judge that versus the risk of one of these healthcare workers who's unvaccinated getting the flu actually and transmitting it to other people, in the hospital, right? So what does it say about the first regulation to begin with, which was probably, in a way, that in my mind was probably, a kind of an unnecessary regulation to mandate, a couple of people in a hospital who don't want to take the flu shot, mandate them to wear masks, as if that was going to make, a big difference. And it's more of a, we're doing everything we can, type of attitude, a very strict attitude, when in fact, and that goes to a lot of regulations, that are actually, we realize now are being lifted in this emergency situation, and then if they're being lifted in an emergency situation, then why do we need them in the first place?
Yeah, you think that's when you need them the most, in the time when you don't have time to really react.
Exactly. So now in New York, the government has lifted all kinds of regulations related to medical licensing and all that stuff. Wanting to get a lot of healthcare workers to be able to help out in this. And that's the right thing to do, right? But at the same time, it's like, well, if that's the case, why do we need licenses to begin with? I mean, in a more in a situation where there's no pandemic and there's more time to deliberate and whatnot, people will judge the merit of a potential candidate, who's going to be a doctor or who's going, or somebody who's going to fill in some shoes to provide some medical services. If we don't need the license in an emergency situation, we probably don't need it even in the regular situation.
Yeah, in our government just yesterday, I think it removed a lot of the, and I guess it's probably to be more clear, this is not removing licensing requirements as it is to change the scope of practice of people who are practicing, who are caring for people. At least I think that's what the case is in New York.
Yeah, that maybe I didn't
look at it in detail. So it's not like
right.
removing a medical license or nursing license. You still have to be licensed through the state, but you can now practice your ability to prescribe medications or to treat people without the supervision of other people has changed. Those restrictions have relaxed, and so but previously you had to have
right. But it's the same sort of. The same argument can be made, right? I mean, it's a similar kind of.
I don't disagree that the argument's the same. I just wanted to be clear for people listening that they're not just having a guy who's a plumber come up and start taking care of people. They're right. These are people who have some sort of medical training, but they are now.
But I mean, even if they did, right? I mean, imagine the government said, anybody can just come and help out. Then clearly locally, a given emergency hospital and whatnot, they will have some mechanism to check out the people who are coming. And I can tell you for sure that it's, in fact, it's probably going to be precisely the situation where you're going to have the most dedicated and competent people who will show up, right?
Yeah.
This is a situation where you're not going to have the quacks coming to the front lines, and putting their lives in danger. This is right. And even if they did, then locally people would be able to sort them out.
Yeah, and I've noticed this, and I've talked about this a number of times on the show, but the certification process for maintain your board certification for physicians, I think it's been relaxed pretty much with every specialty at this point. They've at least anesthesia, I know they said basically waiving all requirements for this year. although I imagine they still expect their check for their fee.
Right.
But and I know the pediatrics has also suspended. My wife's a pediatrician, so I know those two specifically. But I believe there are other ones that have been relaxed too, which I guess goes to the point that, well, clearly it's not important, right? If it's so important for you to maintain the certification, whatever their process is, then it shouldn't matter what's going on. You absolutely need to do this sort of thing to be qualified to practice medicine. But clearly it's not. Because
Right.
the way
Right.
I mean, I think the other part too, when it comes to that, and this kind of goes into the next sort of thing I want to talk about briefly, is I want to say, first of all, I don't expect anyone to cry over a physician not being, making any money or being out of work for a little while. I don't think anyone's going to shed a single tear for that.
Mm-hmm.
However, it is an absolute reality that most physicians don't work on the front lines in the sense they're not dealing with coronavirus in the hospitals. They're not intensivists. They're not ER physicians. Most of them are like primary care, where they may have a couple of patients who have it. They send them to the hospital, but they're not directly taking care of them. And their practices are pretty much getting shuttered by these laws, by these stay in place laws or shelter in place laws. Right. I'm an anesthesiologist. 80 to 90% of my work is elective, which means I'm down to about 10% or 15% of what I need to do. We have massive amounts of our group are idle any single day, because you're just, no one's coming for most of the work that we do. Mm-hmm. And so that's going to affect physicians, especially ones who don't have institutional backing, like yourself, for instance, as a direct primary care doc doing cardiology. Right. What is your feeling how it's affecting you in your practice? And maybe what do you think the implications are for other physicians? Are they going to come out the other end of this with their practice intact, or do you think there are going to be a lot more consolidation or bankruptcies?
So there's this huge concern for the last few years. There's a shortage of physicians, a shortage of doctors. We need to, massive subsidies for residency programs to increase the number of medical schools, because we need so many doctors and whatnot. And I was always very skeptical of that claim, because that shortage of physician really is in the context of situations where healthcare spending is highly subsidized, through the subsidies from the government, through Medicare, the Medicare program and the Medi-Cal programs, but also through the subsidies of the government indirectly by the way they essentially subsidize or help out the health insurance industry with payroll tax deductions, with a variety of laws that allow health insurance to be around. So there's a whole lot of subsidy for healthcare spending. And my feeling was that actually this probably was not, I couldn't prove it or anything, but I was skeptical of this notion that there was a true shortage, meaning true in the sense that if you remove all the subsidies and whatnot, what does the market need, and where is it going to settle? And I'm what I see right now is that with this pandemic, people are self-rationing, right? They're not going to the dermatologist as much, or to the cardiologist for sort of an elective consultation for palpitations that they want to come to see me just because they want to be reassured, but they actually otherwise could live with. I mean, everybody now is making his own or her own sort of risk-benefit calculation, right, before going to the doctor, or before going to get a blood test, or before going to get an X-ray, and so forth. And many are, curtailing just naturally, even without the shelter in place. Again, many of them would have, we would have seen the usage of healthcare services plummet, and the more it gets extended, the more we will see whether it's, is it going to be just a pent-up demand that will all of a sudden surge when the shelter in place is removed? Or will people realize that, hey, listen, my palpitations have gone. I don't need that consultation with the cardiologist anymore. Or I don't need that routine blood test that I get every 6 months, or blah, blah, blah. Right? I can just, try to take care of myself. And so I think we will see that. And I think we will see to the extent to which healthcare services have been, subsidized. The demand is in a way artificial. And that's bad news for a lot of doctors, perhaps even including me. I mean, I don't know. At the end of the day, my cardiology practice, to what extent it will bounce back to its pre-COVID-19 level. But that's the reality. And if that's the case, then we will need to change what we offer so as to meet the real demand of people, right? Each time we meet the artificial demand, right, we're meeting a fantasy demand, not a real demand. And to the extent that we actually meet a real demand and provide, real value that is not subsidized and so forth, then we can be more secure in our profession, whether we're doctors or plumbers or bakers or whatever it is.
Yeah. Well, it is funny because it's hard to know what is real demand today is maybe not real demand tomorrow, right? Basically, because you're responding as a patient, you're responding to all the different signals, like, oh, I only have a small copay, or I risk going and getting the plague when I go to my doctor, and so you make those calculations. I know I remember as a medical student spending time in a family practice clinic in rural Iowa, and I felt like at least half, if not more, of the visits were people who were coming in for colds and for things that there was really nothing to do. And I don't know if it was reassurance or they wanted a note from a work note, so they could stay home. Mm-hmm. But it never seemed like all those visits were really necessary. Yeah. And that things that I thought I would never come in to see the doctor for these sorts of things. Now, my dad was a doctor, and so you pretty much had to be bloody or something really had to be broken for you to go to the doctor. And same thing, you talked to me who was raised by a nurse, right? The same thing. But I agree. I mean, I think it's hard to know what the real demand is because of all the different incentives or lack of constraints for spending and stuff, and that with the whole third-party payer system.
Right.
So,
but yeah, you're absolutely right. But to go back to one element of what you were saying just a moment ago is that the difficulty now is that you will have some doctors or some healthcare workers who are more subsidized, who will remain subsidized in the system than others, right? And that will strike a lot of people as really unfair, right? That because they have the backing of an institution or this or that they continue to get the subsidies, whereas maybe other more independent doctors in private practice and somebody's an allergist or whatnot, that they see their numbers plummet and they feel it, just if they had been in a different institution, they would have had sort of an artificial backing. So you may be right that there may be at least a hope towards more consolidation. But that consolidation may not materialize because maybe the institutions won't be eager to add a lot more doctors to their payroll,
right? If
they realize that at the end of the day, they don't need that many.
Well, sure. I think you're right there.
Yeah.
The last thing I want to kind of discuss, and this is the impossible to know the answer, so we'll just speculate together. This at some point will come to an end. I think your point earlier, you're talking about the flattening the curve, and I've talked about this in my show as well, that by flattening the curve, I mean, you essentially need to get some sort of herd immunity to this disease, whether it is through actually contracting the virus and being infected and then getting over it and creating your own antibodies to that, or receiving some sort of vaccine, which gives you your body to form the antibodies to have immunity to the virus. So you have to have, obviously, vaccines year away, probably till next year sometime when we have access to it. So we're going to be going through this round and then probably multiple other rounds, as you mentioned. By flattening the curve, you're just slowing the time it takes to get that herd immunity. It prevents the hospital systems from getting overwhelmed because probably you're more limited by hospitals' equipment and personnel.
Right.
It just for a little bit, and maybe that will cause greater harm and morbidity, mortality, just because there's not enough equipment to take care of people. But essentially, if you just slow this down over 6 to 12 months, I mean, you can't have the country on economic lockdown for months because it'll be cataclysmic for everyone's way of life. I mean, there's just no way it can possibly be done.
Sure. At the same time, it'd be. I'm curious to see. I'm sorry. Go ahead.
Oh, I mean, my question is pretty. I think we're about to answer. So, how do you see this unwinding? Because, I mean, I feel like you have to have, until you have widespread testing, you're not going to feel comfortable ever unwinding sort of where we are now. And then, what do you think? See the course of, I guess, the next 12 months with this,
right.
coronavirus. Are we going to? Maybe we're going to find it's not that bad.
Very good question, and I'm concerned that again the bureaucracies are going to be very skittish about winding it down, because by nature they tend to be very to have a lot of inertia. Once they have something in place, and then they they'd be concerned if they wind it down, and then you see more cases. And so I don't know what I found interesting is that clearly this pandemic, our society was polarized, has been polarized for a long time, especially in the last few years, and then the pandemic is polarizing people also. Right. It seems that way on social media, that people are kind of polarized about how the response should be and so forth. But the polarization is not necessarily along the usual fault lines.
Yeah, it's not right or left.
Right, it's not right or left. I see people on both, right, that I would have expected to take one position to actually take another position, and I find it kind of interesting. And so, to answer your question, one thing that I think is interesting right now is that if the San Francisco mayor, London Breed, by her action, and the governor of California, both who are very sort of liberal, left, progressive, and whatnot, have taken positions that now are recognized as being, probably the right initiative to take. In terms of winding down, the guy who has the most credibility right now is Dr. Gottlieb at the American Enterprise Institute, which is of a kind of a more of a free market, right-leaning think tank. And he came out, I haven't read it, but yesterday I think they came out with a white paper. And he has a lot of credibility because, early on in the pandemic, I think he was saying that, if you go back and look at his tweets from January and early February, he really saw it. He really saw what the problems were, that the hospitals were not getting, the right tests and so forth. And so he's gained a lot of credibility during this pandemic. And now he has a paper with, some kind of, roadmap of how we wind down these shelter-in-place lockdowns that are, all over the country. And so it's kind of interesting, and I think it'd be a nice denouement if it turned out that we have sort of left and right coming together. If now the people on the left who've instituted these shutdowns early on, turn to the American Enterprise Institute for advice on how to wind them down, that would be interesting. So, but that's all I can say. I don't know really. I don't have any prediction, as you said.
Yeah, I don't think I don't think anyone who says with any certainty how this is going to go, or the severity of the disease or anything else can say with any sort of certainty without having any sort of idea what the underlying numbers are. We don't know the denominator. We don't know how many people have this. Maybe we're farther along in this whole thing than we think. It's entirely possible that there are far more asymptomatic people than we anticipated, right. And maybe we're going to be to the point where 25-30% immunity, and that might be enough to prevent any massive outbreaks here going forward. But it's just, without having any sort of data, it's impossible to sort of make these predictions. Without a doubt, though, we will see a lot of people dunking on each other or attempting to politically from the parties, and so I think we'll see the same polarization on the other side when this is all done. People criticizing Trump for his response, or the governors, or whomever, because it's impossible to prove one way or the other what would have happened had they taken a different action, right? I think. Right. And I think a lot of these things that are blamed on people today are actually could be laid at the feet of generations of people who set forth the regulations and institutions that are the ones that are maybe hampering or impeding our. Right. Yeah, ideally, for the next, in the future, at least my wish list would be less regulation overall, in our day-to-day lives, more to promote more trust, more trusting, to be more trusting of the people, so that in turn the people can be more trusting of the institutions that are running the show. Right, so less regulations to give us more flexibility to respond better, so that when we need more intervention from the institutions, then we have more trust in the people who are running those institutions, because by then, if we have less regulations, those institutions will actually inherently have less power, right? Right, and therefore they'd be less political in general. As a general, they'd be less political. If they have less regulatory power, they'd be less political. Then therefore they'd be more trustworthy. Because at the end of the day, just as you said just now, it's impossible to know which is the right or wrong decision. You just have somebody to make the best, judgment call they can,
and go with it, and not spend so much time bickering about what could have been done.
Well, my dream is that when we come, again, at some point we're going to come out of this, I imagine this summer, or near the end of the summer, we're going to start emerging from our cocoons and re-entering society. And the political process will begin up again with the presidential election. I would hope, and I know right now the two major party candidates are not the ones who are going to do this, but I would hope there be a voice of someone who say, look, let's look at what the reason we had problems was not because we were unprepared as a country in the sense that the government wasn't ready for this, because you can never be ready for these things, but we had institutions, we had processes in place which prevented us from responding adequately and quickly enough. And so we need to rethink those things. I know that's not going to be the message from anyone. Most of the check marks on Twitter, those docs who are in, at Harvard or, who work at the CDC or FDA, they're all going to be calling for more money, more regulatory oversight, and the ability to stockpile, billions of masks and all these, things. Whereas probably looking at what the root cause of that would be, I hope someone's there articulating that point. That would be my dream. I don't know if it's really going to happen, but well,
let's hope so.
I really appreciate the conversation. I wish you the best of luck. If people have not had a chance to read your book called Moving Mountains, I think if they become a supporter of your show, they get a complimentary copy as well. I'd recommend anyone go to the Accad and Cook Report, add it to your podcast player list. I know I do. You had a great interview recently with Russ Roberts from Econ Talk, and it's been a delight. Where is a great place for people to keep track of you, Michel?
Thank you. So they can follow me on Twitter. It's at Michel Accad. So it's first name, last name, MICHELACCAD. And I think that's probably the best place. Or the accadandcocareport.com.
Well, thank you so much again. Appreciate it.
Pleasure.
Thanks for listening to The Paradox. If you like what the doc is doing, please subscribe and leave a review on iTunes or Stitcher. And share the show with your friends. Become a supporting listener to get access to special bonuses at patreon.com/theparadox. Show notes can be found at theparadox.com.